Good afternoon. Thank you for watching our live update for Tuesday, February 23rd. Appreciate everyone's understanding as we canceled our live update last Thursday because of the weather, and everybody had sort of some juggling responsibilities. It was very helpful for us to not do the live update, so I appreciate everybody's understanding with that. Today, I have a few updates for you. Then you're going to hear from Debra Jacobsen, Jessica Corbitt, and Chaplain Logan Augustine has our pastoral care segment. So in some good news, in our region, we're seeing the positivity rates finally come down. And so for our region, the Henrico County, Richmond area, the rate has now dropped below 10%. It's at 9 point something, which means that we can officially move to testing our Parsons Health Center staff and any staff that work in Parsons, including housekeeping, engineering, dining, and all of our support staff that need to work in Parsons. They can all now move from being tested twice a week back to once a week, which is a big help to everyone. Being tested twice a week for the staff is a huge burden. And then on the management team that needs to do the testing, it's been a 6-day-a-week exercise, and it's very expensive. So going back to once a week, which is what we continue to test our residents in Parsons, is once a week. That's a very helpful place for us to get to finally. We're happy about that. We have had a few new cases of COVID-19 on campus. I want to share those details with you. Since the beginning of February, we've had a total of 5 independent living residents in the tower who have tested positive for COVID-19. We learned about 3 new cases over the weekend. Now, unfortunately, 2 of the 5 that have tested positive have some symptoms that are serious enough that they've had to be moved to our COVID-19 unit for some nursing care. So while their situations are, I think, stable, they do need more care than can be handled in their apartments. One of the 5 who've tested positive in February has recovered and is now considered well and out of quarantine. But the 4, we currently have a total of 4 residents who've tested positive. Several other residents have been exposed, and so they're in quarantine because they had interaction with these residents. Now, everybody that we know of who's been exposed has been contacted and is on our quarantine list. And so we think we're in an okay spot, but we need to really keep an eye and keep in touch with anybody who has any symptoms, any kind of symptoms at all. We need to know about it because we don't know what the source of this is. And so there definitely have been a couple of gatherings in some apartments, which has led to a couple people needing to be quarantined. We definitely want you to curtail that. We've asked you not to do social gatherings in people's apartments. Unfortunately, at least in this situation, a number of people are in quarantine because they were potentially exposed. And we've traced back a whole bunch of other potential exposures, but we don't know what these cases, how they were spread. We'll continue to work through that. I want to give a big thank you to our housekeeping team who've done a very thorough job of disinfecting the situation in the tower. They've been doing this disinfection in the evenings on an ongoing basis. They've gone ahead and done a special cleaning and sanitization, it's a hard word to say, sanitization in the tower, on all the tower floors and in the common spaces and in the laundry rooms. And we'll keep doing that for the future here. But the team's been working hard to try to make sure that all the public spaces are clean and they stay that way. So again, if you've got any symptoms at all or you fear you've been exposed, let us know and we will follow up on it. One other additional item, last week on Thursday, we did have a housekeeping employee who was tested off-site and was exposed off-site tell us about their results. This employee hasn't been on campus in 11 or 12 days. So that's the good news. But we did have a housekeeping employee test positive and is out on quarantine. Thankfully, most all of our other employees have recovered and have returned to work. So with this newest case, there's only 2 staff who are currently out recovering in quarantine. That's really good news, because for a while there we had quite a few staff who were being impacted. But those numbers have really come down in the last couple of weeks, and that's really good news. I just want to remind everybody it's really important to continue to follow all the guidelines that help us prevent COVID-19 infection. We are very grateful that most of our community has been vaccinated, and many, many more will get vaccinated tomorrow and Thursday. And that will certainly help us curtail the spread of this virus, but it doesn't mean that it's over. And we likely will continue to see some cases of COVID-19. Other communities out there are continuing to see some cases. So we need to keep our guard up. Like I said earlier, some of the residents that are currently in quarantine are in quarantine due to an exposure that they received from taking part in a small gathering in someone's apartment. So really want to discourage that, because we just don't know. I mean, for all of us, we just don't know if we have been exposed, if we have the virus, and so it's best we not do that. So even if you've been vaccinated, and most of you will get vaccinated again, their second dose tomorrow or Thursday, please continue to follow all the principles that we've said so many times. Wear a mask when you're around others, wash your hands frequently, use hand sanitizer, keep your distance. Social distancing is the best defense. That's the one thing that works, is staying away from other people. Stay away from, to the degree we can, us staff, we need to keep our distance from residents, and vice versa. Residents need to keep their distance from each other. Stay home, stay in your apartment or in your home. If you don't feel well, contact the clinic or contact your physician. Avoid groups if you're off campus, and then follow all the guidelines if you think you've been exposed or you learn you've been exposed to someone who's tested positive. We are continuing to work very, very closely with the Virginia Department of Health. Every time we have a case, the epidemiologists are involved, and they help us contact trace, and they're reaching out to everybody who's been exposed. And they're really the ones who determine the quarantine guidance and the contact tracing guidance that comes from the epidemiologists at the Virginia Department of Health. So maintaining our safe protocols that we've talked about since the beginning, and being responsible with our personal behaviors, is really going to be critical for all of us as we strive to get this community and all of our community's programs and services restarted. We got to get back to a place where we don't have any virus in the community, and hopefully in the next week or so we'll be back there. So keep doing what you've been doing. It's been working really good. This week marks our last vaccination clinics in partnership with CVS Health through the Pharmacy Partnership for Long-Term Care program that you have heard a lot about over the weeks. Our independent living residents and our last employees will receive their second doses of the COVID-19 vaccine from Pfizer, the Pfizer vaccine. You'll get your second dose either tomorrow or Thursday. Debra will be out here momentarily to share all those details. We're also working behind the scenes on details for helping new residents that'll be joining us, or new admissions into Parsons Health Center, and new employees get vaccinated as they come into the community. The Virginia Department of Health has introduced a new program that we have submitted our data into to link us with a future provider for those continued vaccination clinics. We'll know more probably next week in terms of how that will play out. Couple other topics before I step away. A number of you have asked, and in a couple of the resident executive meetings it's come up, about the future of the BB&T Bank. And just being completely honest, we have not been able to get a commitment from BB&T about when or if they'll be returning to this bank location here on campus. And that's frustrating. It's frustrating for us, and I know it's frustrating for you. We are working behind the scenes to get some movement from BB&T or some other bank partner. Unfortunately, to date, no organization we've spoken with has been willing to commit. So as soon as we have more information, we'll share it, but unfortunately, there's just no good news to share there. And then the second thing I wanted to say is in the coming weeks, and it won't be next week, it'll probably be the week after, we will begin to share our planning details around the Promenade Dining Room project and our expansion project, which we call the Vibrancy Project. Both projects have been moving their way through the design process and the pricing process. Throughout the last 6 or 8 months, we've been continuing to work behind the scenes with all of our architects and designers, and the dining team has put in a lot of the work required to get the Promenade project ready to go. And so we will begin sharing our communications plan so you'll know what to expect in terms of what information will be coming and when and in what format. Probably through this format, at least at the beginning, while we're still in the process, we're not able to get together. But other ways too. We're going to work to get this information out to you. We want to share the design details and the timeline of the components of these projects in the next few weeks. So look for that. I'll share more of a timeline once I know exactly when I'll be sharing it, so you'll know when to tune in for those elements. So that's it for me today. Next up is Debra Jacobsen. I will see you either tomorrow at your clinic if you're scheduled for Wednesdays or on Thursday, and we'll be celebrating getting everybody vaccinated. So thanks, everyone. Have a good day. I'll see you soon.
Good afternoon. For all the independent living residents, you should have received a memo in your box this morning with the schedule for the independent living vaccination clinic scheduled for tomorrow and Thursday. The schedule has been slightly adjusted since our last vaccination clinics. Vaccinations will begin at 10 a.m. And we do ask that some of you come a little early so we will be ready to begin right on time. At your scheduled time, please make your way down to the Sarah Bell November Theater right here. A staff member will hand you your paperwork, and you will be asked to take a seat here in the theater until your name is called. You will then be directed to the CVS registration table in the Foundation Hall, and you will go to the CVS registration table. You will start to make your way towards the Cochran Commons then to receive your vaccination. After you receive your vaccination, you will be asked to wait for 15 minutes under a nurse's observation. The nurse will let you know when your 15 minutes is up. We ask that all independent living residents be ready and make your way to the theater at your scheduled appointment time. Please plan to dress comfortably. If you have an essential appointment and cannot attend the vaccination clinic at your scheduled time, please attend on the day your schedule allows you to come. Thank you for your patience as we navigate through this process, and we look forward to seeing you tomorrow or Thursday. A quick note from the Courtesy Services Department. Our transportation team is working diligently to keep you safe when you travel to the grocery store. We are social distancing you with putting no more than 8 residents on the 32-passenger bus at a time. We keep your groceries close by, and then we clean the bus as soon as you're finished with your grocery shopping. What do we ask of you? Keep your mask on. That means over your mouth and over your nose at all times when getting on and off of the bus and while you're traveling to the grocery store, and for your own safety while you're at the grocery store. This is a plea from the drivers. They hate to have to ask you to do that, so if we can help them out, that would be greatly appreciated as we travel to the grocery store 3 times a week. That's all from me today. I look forward to seeing you all at the vaccination clinic so we can get this behind us, and look forward to seeing you tomorrow. Up next is Jessica Corbitt.
Good afternoon. I'm here to tell you about a small service that you may or may not be aware of here at Westminster Canterbury. Did you know that Westminster Canterbury has an extensive DVD library? We have over 1,300 DVDs available for our residents to check out. The DVD library is located inside the McGue-Millheiser Art Studio, and the library is stocked with newly released films, art and travel documentaries, as well as many wonderful classics. We have recently created an online database for the DVDs. We'll share more information in the tales regarding how residents can access the library from home to search for films. This system is the same one that is utilized over in our pastoral care area. Today, we're going to highlight the new checkout procedure. We've created a short 2-minute video to walk you through the process.
Welcome to the video tutorial for the new digital DVD library checkout system. Located in the Art Studio, we have over 1,200 titles available for checkout. The new checkout system is easy to use, and this video will tell you everything you need to know about how to check out a movie. Before we start, here's a couple important changes. First of all, paper checkout slips are no longer used. Instead, you'll use the iPad and barcode scanner along with your Westminster Canterbury ID badge to complete the checkout process. Next, every movie is now cataloged digitally. Using the iPad, you can browse the catalog and read details about any movie. The catalog can also be viewed on your own device at home, whether that is a computer, tablet, or smartphone. Simply open your web browser and type in the link you see here. The checkout process is fast and easy to learn, so let's get started. The first step is to pull the DVDs you want to borrow off the shelves. You can check out multiple movies at once. Flip them over and locate the sticker with the QR code. The square-shaped code is what you will scan. Go over to the iPad kiosk and type the white checkout icon to open the checkout application. Tap once where you see the words Enter Item Barcode. You should see a gray bar appear at the bottom of the screen. This tells you the iPad is ready to accept input from the scanner. Hold the QR code on the DVD case under the scanner. It will turn on automatically. Center the red dot over the QR code. The scanner will beep once upon a successful scan. After scanning, on the checkout screen, you will see your DVD appear. If you have more DVDs to check out, continue scanning them one at a time. Once you are finished scanning every DVD, tap the blue button that says Complete Checkout. Tap once where it says Email or Barcode ID. Then, scan the barcode on your Westminster Canterbury ID badge and tap the blue Checkout button. You will see a message appear briefly at the top of the screen that your items have been checked out successfully. Press the Home button to return to the home screen for the next user. To return your DVDs, just drop them in the drop box as usual.
In addition to the video, there are detailed instructions posted in the Art Studio to assist you with checking out films. Sarah Abernathy and myself are also always available to help, but it is a pretty intuitive process once you try it out. If you have any questions or requests for the DVD library, please don't hesitate to call. I'm happy to order new DVDs that you all are interested in or bring in the latest film that you want to see. So just give me a call at extension 6695, and please join me in welcoming Logan Augustine.
Good afternoon. I'm Logan Augustine in the Pastoral Care Department. I have a few announcements for you today. Please join us on TV 970 for our worship service this Thursday at 10:30 a.m. Reverend Dr. Rebecca Weaver will preach, and resident Susie Frazier will play the piano for us. Our Daily Prayers booklet for March is going to print soon. If you have received a copy in the past, you will receive a copy again for the month of March. However, if you have not received a copy and would like a copy of the prayer booklet, please give Vanessa Perry a call at extension 1502 or call David Curtis at extension 5179. You may have noticed purple prayer ribbons on your neighbors' doors or perhaps around campus. The prayer ribbons can be found in the center business area, the tower lobby, and the sanctuary to pick up if you would like one. Residents are invited to take a ribbon or two and place them on their door or their walls. They may also be tied to the gates leading to the Emmaus Garden at the Spiritual Center. These ribbons are a visible, tangible sign of our prayers this Lenten season. Last week, we observed Ash Wednesday, a day beginning our journey into the Lenten season. I wish each of you a blessed Lenten season this year. However you observe this time, I hope it is fruitful and meaningful to you. There are many ways to observe the Lenten season: devotions, different practices, from prayer and meditation to learning something new, giving something up, or taking on a new practice. These practices help us to turn toward God. There is a Journey Through Lent calendar made by the pastoral care staff that is available to you either in the daily prayer booklets or in individual copies, which can be found at the center and tower lobbies. Each day of Lent is marked with something meaningful, an action or a prayer, or perhaps a time of silence. I noticed that on Ash Wednesday, the calendar says, "Forgive others, and then forgive yourself." What a sacred way to begin this Lenten season. Forgiveness allows each of us to heal. When we are able to forgive another person for whatever reason, we allow something within us to be transformed. Forgiveness does not make what someone else did right, and forgiveness does not mean forgetting who or what hurt you. It does not relinquish someone else from accountability. Remember, forgiveness is not the same thing as reconciliation. Reconciliation is a full restoration of relationship, of mending what was broken. However, forgiveness is a gift for us to let go. Forgiveness is a gift for the hurting and the broken. It is an invitation for us to let go of anger, fear, and resentment, to let go of those things which don't serve us well. It's an opportunity for us to practice grace to others and to ourselves. In these days, which sometimes feel so heavy, I invite you to think about the things which you can forgive in others and in yourself. What do you need to let go of individually? What do we need to let go of collectively as a community? As we begin this season of Lent, let us begin by turning toward God, a little less weighed down and with a little more grace. The following prayer comes from the New Zealand Book of Common Prayer. Let us pray. Happy are those whose sins are forgiven, whose wrongs are pardoned. I will confess my sins to the Lord. I will not conceal my wrongdoings. God forgives and heals us. We need your healing, merciful God. Give us true repentance. Some sins are plain to us, some escape us, some we cannot face. Forgive us. Set us free to hear your word to us. Set us free to serve you. God forgives us. Forgive others. Forgive yourself. Through Christ, God has put away our sin. Approach our God in peace. Amen. Thank you for joining us today, and we will see you on Thursday for our next live update.